Well, it's the easiest thing to measure in primary care is what drugs you're prescribing and how much it's costing. And I think we're all acutely aware that we don't really want to be an outlier on the expensive side of things. So I think there's been it's a well-trodden path to be as careful as you can to prescribe clinically effective, cost-effective medication. And there have been various schemes over the years to incentivize general practices and now PCNs to be just that, to be cost-effective and clinically effective. What's more difficult is judging the outcome of choosing one drug over its competitor in terms of use of secondary care, morbidity and mortality. And because there are so many other variables, that's a really hard one. But I think that the emphasis on cost-effective prescribing will never go away, and we're all very well aware of that. And we personally, at our PCN, we employ 2 pharmacists and 1 pharmacy technician to help us be as effective as possible in that respect.
And could you just expand a bit more in terms of those pharmacists on kind of what their jobs look like? Is it about just keeping on top of reviews and making sure people are getting the right things, or are they doing more besides that?
Yeah, I mean, they are doing reviews. Of course, they're also dispensing advice to patients who appear to be outliers in the use of, for instance, inhalers. So there is a bit of a clinical role there as well. But they support the lead GP for medicines with regard to evaluating new medications and new products, evaluating NICE guidelines that actually refer to changes in medication. So they're part doing reviews, but part of the mechanism for making sure we're as effective as we can be and as up to date as we can be with our prescribing.